Oh, I appreciate that, but
Right, Councillor Gibson, it's about to go live.
Thank you very much, Louise.
We are live.
Hello, welcome. Sorry for the delay to the start due to technical reasons, but we should be streaming and it should be all going ahead. Thank you for your patience. I'd like to and just wait for Councillor Dale Birch, who I can see is just coming online now. Dale, welcome. I'm just starting the meeting just to say that it's being broadcast. Now, can I ask you, this is the normal formal start, please turn off your microphones and video and only turn them on if you're going to speak. Lou may put everyone on mute if there is feedback or background noise. So please remember to unmute when you need to. So don't forget to unmute, use the camera when you're speaking, and please say your name. We should be experts at doing this. Welcome, thank you for attending tonight's meeting. I think it's very important that we, for Scrutiny, not only to carry out the reviews themselves, to actually see what the outcomes and impacts we have made, and that's what tonight's session is all about. So we're not trying to, revisit what we were actually looking at, but rather we are trying to make sure that the what's happened to the recommendations that we have made. And I'd like to thank Councillor Dale Birch for attending this meeting this evening, and also to the officers for preparing the data we have received in advance of the meeting. Welcome Simon McGurk, who's the interim head of adult community team and interim care services, and Lisa Jewell, business change partner, who I'm sure will be happy to take any questions after their presentations. Apologies, Lou, have you received any apologies?
Chair, I've only been notified that Councillor Templeton will be late.
Great interest in expecting to see at some point. Right, now,
yes.
Declaration. Sorry, Michael.
No, I thought you were on mute. Forgive me.
Can you hear me? Is that okay?
Yeah, we
Right,
can.
okay, good. Because otherwise I've been speaking to myself for the last 5 minutes. Right, second item is declarations of interest. I am not going to read the entire declaration out, but I will say I have a member of my family who has a blue badge, but I believe the experience will help this review. So it's not pecuniary, but it would just disclose it for that reason. 3. So we are just going on to the review of. I'm not sure how many of you here were here for the original review of the blue badge, but there was a BBC report which suggested that we might not have been doing as well as we might have done back in 2021, and it was highlighting the difference in approval rates between physical and visible and invisible blue badge applications, and how they were, what the level they were being reached at. So Nick, good, excellent, thank you for that. Nick Allen was part of that original review, for those that can't see the message he's just put up. It actually, the review did find that we were proportionate, but there were things that we thought that could be improved, and those recommendations were made. The review took place in 2021, it's now 2023, so some of the recommendations have been implemented, but I know Simon and Lisa are going to address that in their presentation. So assuming everyone's read the documentation which was sent out last week, I will ask Simon and Lisa to start with their presentation.
Okay, Simon, did you want me to share the slides first or the Word document?
The slides would be great. Thanks, Lisa. So hello, everyone. As Councillor just mentioned, I'm Simon McGurk. I'm the head of adult community team and integrated care service and I'm overseeing this project. Lisa is also managing the project as of relatively recently, but has a great overview of it.
Thanks. Sorry, I'll just move to the next. Can
Great.
everybody see that, just to check?
Yeah, yes, I can. Yes.
Just to mention before we start as well, Grania was going to be joining us, the Executive Director for Adults and Children, was going to be joining us. She's got a family emergency. She may join us at some point if she can this evening, but she's not here at the moment. Okay, so as Councillor Gibson was mentioning, there was a review of the Blue Badge process and various recommendations made to how the process is managed, and ensuring that applicants have a proportionate and fair outcome, whether they have a hidden disability, so something along the lines of a learning disability, or someone who is autistic, or a physical disability. And I think I'm right in saying, although I wasn't here at the time for reading the information, at the time we were in the lower percentile for awarding Blue Badges, and there were some discrepancies which we wanted to put right, including in the process, how we manage the process of applications. So this first slide demonstrates phase one, which describes the process of how someone makes an application, how it's assessed by our Blue Badge team in adults, and where it goes to in the process to be verified, including appeals. So this describes who's involved in each stage of the process. We have, at the moment, customer services aren't involved in the process. This is the process as we want it to be. So we are moving towards this being an entire description of the process on slide 3. We have achieved the majority of our intended changes in the process. So the slide 4. So I wasn't ready for that, Lisa. You took me.
Sorry.
Yeah.
Do you want me to go back?
No, I was just waffling on about that. Don't worry. Cheers. So in terms of the project, we are behind. It's worth saying clearly that we are behind in our process for where we intended to be. As I was saying, the majority of what we feel are the most impactful changes we've made. So, for instance, one of the major impacts we wanted to ensure happened was that there was a proportionate application of expertise to assess someone's application for a Blue Badge, whether they had a physical disability or a hidden disability. We wanted to ensure that those individuals received a really expert assessment and went through a fair decision-making process. We believe we've absolutely managed that now. For instance, if someone isn't automatically awarded a Blue Badge, we'll see later on in some of the data, some people are awarded automatically, others obviously aren't and need a further assessment. But when a further assessment is needed, they'll be seen by a subject matter expert, whether face-to-face or remotely, and the same goes for appeals. So we can see here the changes that we've made that have been implemented, and the changes which haven't yet happened, and the major implementation that we want to bring in as soon as possible that hasn't happened yet is the use of the website and some of the automated processes.
So
Okay.
can I just come in quickly, Simon?
Absolutely, please do.
I was just reviewing the sort of, well, not for the first time, but just reviewing the previous recommendations and having had some time one-to-one with the actual members of staff and officers involved in the processing. We've actually, the interim process that was rolled out in March actually has put in place some of the digital requirements that were recommended with regards to capturing all of the sort of reasons for decisions, types of applications, and different types of data sets, so that we can report on applications, sort of outcomes. Also, some of the other sort of recommendations that were made. The part that's delayed is our end-to-end system that's being designed so that a customer can complete an online form that feeds automatically into our back office system, that then automatically feeds into the government system to issue a badge. There is an interim solution at the moment where application forms come into our team, but also directly made on the government website. They are then recorded within a digital system, an LAS system. So all of that vital information is being recorded and has been being recorded since March this year. It is just sort of bringing it all together in this one end-to-end that is delayed from my perspective, but I am sort of only 3 or 4 weeks on this project, but that's what I've gathered from my observations.
Thanks, Lisa. Should we move on to the next one? Yeah. Do you want to speak to this, Lisa? Because this is some of the
yeah. So this was just a slide to sort of say what we as a team are still sort of working on to get this over the finishing line. So there has been a few rounds of user acceptance testing. That's what I mean by UAT. We had to do front end testing with the forms, customer services and our team members helped us with that. We would also like to get some user acceptance testing completed on the form by some perhaps members or customers that we're aware of with badges that would be willing to look at that for us. We've also done initial testing with the system, back office system. The issues that were found or items that needed tweaking have been raised and are being worked on by the developers. And as soon as those are resolved, we've got a team ready and waiting to retest those. And whilst that's happening, we are preparing everything, such as finalising the website ready to turn on, and training and transition for our staff and also the teams that are going to support the process. So yes, we are delayed. And on the previous slide there were some sort of reasons. It's difficult to look back, someone who's sort of just come into it or hasn't been around the whole time, to look back and find out why. But the sort of the key reasons I've come across were general sort of resource availability and project prioritization. There's only a certain amount of resource within operational teams, but also within the project teams, and that wasn't always prioritized for this project. There has been a lack of or reduced project management support as well. I'm actually I'm not a project manager, I'm a program manager, but I'll be the third person leading this project now. There's been a bit of a turnover.
Thanks, Lisa. Shall I just explain some of the terminology as well? So when we talk about what was it, UAT? What's that again?
User acceptance
testing. I was right. So what we're talking about there is the people who were actually doing the job, our business support staff, our admin staff who are administering the Blue Badge scheme, the people who are involved in providing the subject matter expertise so people involved in the actual system at every stage are involved in designing this. And they've provided some absolutely, as you would expect, crucial insights into how we're managing it. In terms of resource, we will all be aware of the pressures within local authorities and health over the last year or two. And whilst we would have wanted this to be further on than it is, we have to be realistic about the impacts on resource, as Lisa was referring to. Having said that, some of the recent issues have been more focused on the technological aspect. So when Lisa's talking about the end-to-end system, we're basically talking about the website and then how we process and manage the information that comes to us from the website and then is dealt with by our experts and admin colleagues. So some of the delays have been in implementing that and technological issues with actually developing the software. Should we move on to the next one, Lisa? Cheers.
Just wake it up. There we go.
Great. So this is the first of two slides that look like complicated and sort of pencils of varying degrees of use. But what this does give is a very detailed view of an explanation of an insight into the how applications are handled, the outcomes from applications, including appeals. So we can see here, for instance, that this first slide describes what's happened with applications for children under the age of 18. And we can see that the total number of applications have been 149 between January and December 22. And some of the people with hidden disabilities that have been approved but haven't been approved automatically. So there's been some involvement from subject matter experts or professionals is 39. The number of people with hidden disabilities, the number of applications of people with hidden disabilities that have been automatically approved are 2. We've had 14 which are declined. And the number of applications for people with a physical disability, we can see are higher, but we can see some of the detail there. I'm not sure how useful it would be to really go into some number crunching here. This is just about giving it an overview, really. So adults, this slide describes the total of adult applications over the age of 18, and we can see a much higher, as you would expect, rate of applications over 2,000. And of these, there are still some people with hidden disabilities who've had applications approved. 10 were automatically approved. 23 had some intervention and oversight. 638, however, of people with physical disabilities were automatically approved, and then a further over 1,000 applications were approved after some intervention. So, you know, it's to be expected that there's going to be this disparity between applications from people with a physical disability and a hidden disability. This may change. We would expect this to increase over time as people, you know, are advised more comprehensively of the process, are aware of the process. But we can see that this is an improving picture. I'm just trying to, because I had some information to. Oh, here we go. Sorry, just managing my screen. So Councillor Gibson referred to the 2021 BBC investigation earlier on. And at the time of the investigation, Bracknell Forest Council had an approval rate for people with hidden disabilities of 35% and an approval rate of people with physical disability of 78%. So overall, between January and December 2022, we received a total of 2,151 applications, and 6.9% of those were for people with a hidden disability. 93.1 obviously were for people with a physical disability. So for overall, there's been an increase in approvals for both people with a hidden disability and people with a physical disability since the BBC article. And the differences were that in January 2021, there was 35% of approvals for people with a hidden disability and 78% for people with a physical disability. In January 2022, that had increased to 46% for people with a hidden disability and 82.6% for people with physical disability. I think that's a really interesting comparison and informative, and it demonstrates an improving picture. But it also, I think, crucially, what the last couple of slides have shown us is that we now can really make visible the process, the outcomes for the individuals. We can see what is happening in our own system much more clearly, and that will improve as the technological aspects of the project move on and develop. Lisa, did you have any?
No, I was just going to ask if we were going through the Word document as well, which was addressing the specific recommendations.
I think that would, so I just, Councillor Mike Gibson here, I think that would be helpful because that is the focus of, to help people look at which ones are the recommendations and what they've done. I think it's a very useful background to what we're discussing, but it's how we have where we've actually got to. And I think if we go through each of the recommendations, that'd be helpful. Can I just ask, does Councillor Birch want to speak now or after? Dale, are you there?
I'm happy for the presentations to complete. Thank you.
Thank you very much indeed. I just thought I'd give you the opportunity because we had a bit of IT problems at the start. So if we can actually go through the recommendations and where we are on those. I see that it's on the screen.
I was just going to ask, what is it up there? I wasn't sure.
Yes, it is.
So I have pulled up one that I had just made a few notes alongside. Simon, how did you want to go through this? Yourself or me, or?
Do you want to talk to it? I'm just conscious of time as well, but
okay, I'll try. Yeah,
the latest notes, that would be great. Thanks, Lisa. And then because you've got that detailed oversight of this part of, and I can intervene if I need to.
Okay. So looking at recommendation 1, it was about capturing the reasons an application has been accepted and creating a knowledge bank. I mean, I think everyone can read, so I won't read every sort of word out. I had put a detailed explanation about where we were with the end-to-end sort of technical system. But actually looking back at this earlier on today, I was thinking actually it's not necessarily addressing and answering that. So as I said earlier, the interim process is already capturing and addressing that recommendation. It's capturing all of that information. Phase 1 of the new system will see an automated process of the subject matter experts being able to complete their stage of the assessment along a journey. At the moment, it has some automation, but it's sort of logging into one and out of another, etc. So, and customer services would be able to assist with easy assessments in phase 1, which would reduce some of the workload coming into the team and make the process more streamlined. In phase, it also recommended other teams being involved in the process and having access to data to improve their knowledge. In the first stage, we weren't looking to be giving customer services or libraries access to that sort of detailed information until they've had some experience dealing with applications and also sort of built up some knowledge base. But the subject matter experts, which is what I mean by the SMEs, they most definitely can access all of the information that they need to be able to build that.
We can say as well that at each part of the process we can we have good data about what's happening, why and when. So if someone's application is automatically approved, for instance, we can see that they have met certain criteria, and the people that have access to the data are the ones that really need it.
I might need your help on this one, Simon, but I remember the second recommendation was about the assessment process, ensuring it has sort of greater understanding of those relevant areas. I understand from you that there are key subject matter experts involved in the process and have been since March last year. So did you want to add to
I
that
think
one?
absolutely. Cheers, Lisa. Yeah, we can clearly say that's been met. We have senior occupational therapists with experience in long-standing experience in working alongside people with a physical disability involved. We also have occupational therapists and dedicated therapists for mental health who have experience in autism and learning disability. So where we need that expertise, we have it.
And then recommendation 3, that the Blue Badge process confirms that the appropriate expertise have been considered and knowledge and items have been considered.
Yeah.
And
shall I, because again, we can see that those same subject matter experts are involved in the appeals, so they can give a defensible, clear, focused response to any appeals that respond to people's needs, and they are. I think there was some question previously about how sort of compassionate, accessible, and understandable some of that correspondence had been in the past, and we have reviewed and will continue to review and audit some of those responses, and we're happy with them on those grounds. Okay.
Okay, so there were various points to the recommendation 4. So a lot of it was around the form being able to and the process being able to process sort of various conditions or fluctuating conditions, hidden and physical. The online form has been redesigned, but because it's integrated with the system, it isn't something that we've released at the moment for use. Sorry, I'm just reading these. Ensure data protection. So we have completed a full data protection impact assessment, and I'm just in the process of a review of that as part of my sort of role coming onto this. As I mentioned earlier, the online form, there is further testing required, and we would like to have some external testing done, because obviously customers' viewpoint is most important here, as well as the customer portal. Ensuring accessibility needs and alternative methods are considered. So as mentioned, customer services will be able to support in the first stages of an application. They can take a customer through the application on the phone. They can answer questions in relation to their application. They'll be able to see the sort of current status of it and whether there's anything outstanding. I've also spoken to the library services, who are sort of willing and ready to support people as well with completing applications if they have to create an email address or make online payments or upload documents. There will also always be the hard copy paper application for those who need to be able to do that and aren't digitally don't have digital access. Sorry. I don't know if you wanted to add anything to this part, Simon.
Yeah, thanks, Lisa. Just to say, I think the involvement of library staff is really crucial in this, and that people will have access to a face-to-face, to a person face-to-face to help complete applications where they're, as Lisa was saying, if they don't have access to digital means. So I think that is a really important use of libraries and library staff, and they are being trained to do that effectively.
Recommendation 5 is something that would be undertaken post go live, so we haven't got sort of an update on that one. Number 6. So this was around the Blue Badge letters. I don't know if you wanted to talk to this one, Simon, but they have been redrafted. but again, they were redrafted to integrate into the new system.
Yeah, we have drafts ready for the new system when we go live. However, in the meantime, we have adapted our usual templates, which we send out to people to incorporate more person-centered, understandable language, more straightforward and less. I think there was a perception that previously letters were quite inaccessible. Language could be perceived as harsh, impersonal, and that isn't the case now.
There's a new, sorry, I don't know if you can hear my background sound, sorry. There's a new design for the website, and new wording was written and signed off by the previous project manager. I'm just waiting to get that so that I can review it and get it sort of finally signed off and get the digital team ready to upload that. I can also then share it, because I think it was previously asked that those words for the website be shared, but I didn't have it, unfortunately. And then I think we've covered this off in the previous slides. These were some specific updates that were required before this meeting around the reasons for the delays and the general sort of timeline of what's happened since the recommendations were made. So
Thanks,
I think
Lisa.
that's it.
Yeah, fantastic. Thank you, Lisa. Oh, hi, Gronia.
Yeah, apologies. I have been listening to the presentation, so I do apologise for joining a little bit later. So I was wondering whether or not you have covered off. So whilst we've had a delay for reasons that have been articulated, it does sound as if a significant amount of the improvements have been made. I will say that Bracknell Forest officers are often used to having to amend and change and manual systems in the background whilst we're waiting for more technologically advanced business systems in terms of delays. And I think people will be well cited on where priorities have been in terms of assignment of project management by the business change team that's happened over the years. So we have had movement, and I think that the issues about workforce, I think, are well documented, and I won't discuss it now. But so, Simon, when can we expect to have all of the recommendations implemented and the system operated, tested? And so it is the original intent of the scrutiny review, and its output has actually been fully implemented. What's that date looking like?
Yeah, we're working towards the end of February, Gronia, for the website to be operational with all of the functionality that we expect. Testing will continue. The crucial aspects of the website and the process will be tested by then, and we've been doing that as we've gone along. But review will continue, obviously, to make sure we will continue to review the process to make sure that it's providing everything that we need it to. But we're confident that by the end of February, we'll be in a position to implement the website.
Okay, and in line with the other areas that we're looking at across the directorate, where we're looking at resident satisfaction, what are your thoughts about how we routinely gather responses, and understand the outcome and the experience of our residents of actually utilising this system?
Every letter which goes out, which we send with a decision or anything to do with blue badges, has included in it a feedback form that we ask for people to respond to. So that's that's one means of doing that. I think we could improve that. I would love to, when we have the website go live, I would love to, review, to include users more in feedback and think of more more interesting and direct ways of getting that sort of direct user feedback, which is crucial. The website, as we know, for the reasons that why we've included library staff, isn't going to be useful for everyone, but we need to monitor that. So we need to make sure that the people who are using the resources at libraries as well as the website are giving us some as clear, honest and usable feedback as we can possibly get.
And Ken, just final point from me, just based on this sort of work that I've done before, can you consider what our response would be if somebody couldn't get to the library, couldn't operate it online, hadn't got access, etc. What would that personal contact be to support somebody to do it for them and with them?
Yeah, absolutely. I mean, that's something which we need to consider more and more, but there are existing sort of pre-social care community navigators, voluntary agencies, CAB, this kind of thing, that who can help with this, and we absolutely need to reach out to them and help to make them aware of the Blue Badge process and the way that we're offering what our offer is now.
Okay, so thank you, Chair, for indulging me. I just wanted to pull out some of the key elements from Simon. So sorry if it was a repeat of what was covered at the early part of the meeting. Thank you.
Thank you, Gronda. That was actually very helpful. I'm going to ask if any of the councillors, if they could put their hands up, if they've got any questions that I can go to speak to them about this. So I'd just like to say thank you for the presentation. It was very detailed. Michael Brossard. Michael.
Unmute and video on. Thank you for that. I thought an excellent presentation. Thank you very much for both Lisa and Simon on that. A couple of questions that I've asked, that I'd like to ask. There are letters that will be issued. Can I ask if those are cut and paste letters? Are they template letters, or are they specific to the individual circumstances? Can I ask?
They are templates, yeah. I mean, there will be some specific detail added to the template relevant to the person, but you can imagine for the amount of applications we need to have a template.
And thank you for that. Also, what I'd like to commend is I like the report itself that runs to 16 pages. I've always believed that less is more, or more is less rather than the other way around. And I think it's been very well presented. So thank you for that. Also, the only other question I've got, Simon, and maybe Lisa, is there an appeal process if someone feels unhappy with the decision? Do they go to the Ombudsman? What is the mechanism for that?
It's funny you should say that, because I to be honest with you, I wasn't aware. I'd assumed that appeals would go to the Ombudsman, but they don't. I've been told that there isn't an appeals, that we have an internal appeals process, but but someone can go through the general complaints process for the council, and then that would lead to the Ombudsman. So ultimately, I suppose they do have recourse to the Ombudsman, but not specifically for Blue Badge appeals. And can I just say, sorry, I would love nothing more than to take the all the plaudits for the report, but those belong only to Lisa, I'm afraid. So
if I can just come in, Isabel. Before I bring Isabel in, I just want to say that I'm sure that the involved in user acceptance would be absolutely fantastic. I'm sure people would be wanting to be involved in that. That in itself is a very valuable outcome of this meeting if we can make that established. And I presume Lisa will be in charge of looking into that. But yes, I think there are a number of councillors with blue badges, also bringing the general public into it. Excellent. Isabel.
Two things. One, I was just somebody spoke to me the other day because they were thinking about applying for Blue Badge, and they said that they had read on Facebook the other day that somebody was quite angry because they've been waiting for a year. I didn't ask any details. I didn't think it was anything to do with me, but I just wondered if anyone ever checks Facebook to see if there are any, some of these derogatory statements. That's my first point.
If I just respond to that, I'm not aware of anything beyond our usual comms responses. I couldn't say how much they monitor local social media, but I can say absolutely confidently we don't have anyone waiting anywhere near that. I think the longest, Lisa, was the longest 3 months. Yeah, I think
struggling to unmute. Yeah.
Yeah.
Yes, I've had feedback about people who've been getting them much quicker, but because it was such a derogatory comment. The other thing is I was still starting to write a message, hadn't finished it, and I accidentally sent it. But I haven't had the papers for this meeting, which I believe are in the post. I went down to Times Square yesterday and I could not find a parking space, so I couldn't go in and ask about it. I spoke to somebody and they said I could go down today and collect some, but unfortunately I wasn't in a position to do so because I have some work done at the house. But just to make sure, to tell you that I haven't received it, but it's quite general because some of the things in the post are taking a long time. Thank you.
Thank you for that, Isabel. I know that there are issues with getting the papers for some of these meetings. I will raise it at the overview and scrutiny panel, the next commission meeting on that. And as for things on Facebook, there's a number of responses on Facebook kicking around, but if they haven't actually directly contacted the authority, it's a bit difficult to chase them up, and that shows the importance of actually funding direct contact on these things, because a year is unlikely if it had been followed up after that sort of time. But I'm not sure. As Simon said, it's not really. You can't monitor all social media things. They have to directly come to us.
And what people can't.
Michael, is that a new hand?
Well, yes, sorry about that,
Yeah.
Chairman, sorry about that. I
No
tried
problem.
to put it up and then it disappeared and then I reappeared. So hold on a moment. Let me put lower hand. The question I'm going to ask really is
Excuse
that
me,
I'm
excuse
aware
me,
that on...
Michael,
I'm sorry, Michael, can I just,
Michael,
before we go in,
we
cabinet
can't
members come
actually
in.
see you. All we can see is the top of your head. And I know you've had your hair cut, but you might like to give us the full benefit.
Oh, right. Well, I know if video is on though, Dale.
Yes,
Yeah,
yes,
it's on, but we
see
can't
you.
see you. We can only
Oh,
see the
sorry.
top of your
Oh,
head.
let
It's
me
the
let
angle
me
of
just.
You
Is
need
that
to
any
adjust
better?
There you are.
camera.
There you go.
The challenges of technology, is that better, Dale? Yes.
There you go. I need to see the whites of your eyes.
Oh, you're very kind then, Dale, very kind. The only question I've really got of Simon is that I noted on page 16 there's a loss of project leads on 2 occasions due to staff turnover. Has that had an effect on it, and how have you actually addressed the resource capability to ensure that it's still on track?
Yeah, I'll be honest with you, it has had an effect, Councillor Brossard, in the sense that, the sense of continuity, but what I can say is that in Lisa, I'm not just saying this because she's here, but in Lisa, we've got a very capable project manager, and she has picked this up really, really quickly. And I think we're in better shape now than we would have been if she hadn't arrived. That's all I'm going to say. So yeah, we're very lucky, and you can see that the amount of detail that she's put into this. So I've got no doubt whatsoever that Lisa will. Well, I know that she's engaged. Everyone in the project already, and that the timeline is safe in her hands.
Simon, thank you for that. I think, can I make a comment to our chairman and to everyone participating, that I think the statistics you provided in terms of the levels of engagement and the number of processes that you've gone through, those have been accepted, which obviously do show a scrutiny. It's not just a case of ticking all the boxes. I think there's been obviously a scrutiny process, but actually, I think it's very encouraging that we actually, I hope, within the processes and the councils comparable to us are actually showing that we are actually we have empathy with our residents. So thank you for that, Simon and Lisa.
Thank you, Councillor Brossard. Can I just comment on that as well, if you wouldn't mind, Councillor Gibson, because I think you're absolutely right. I think the level of scrutiny and grip over this process is really, it compares hugely favourably to other councils in my experience. I think also, we need to, and I should recognise that Melanie O'Rourke, who isn't well at the moment, she's been responsible for this over the period of time as well. So a lot of that level of oversight and grip is down to Melanie also.
Sorry, Mike Gibson here again. I'm just looking to see if there's any more questions, or if there are any comments from councillors or councillors who are involved. I'm not seeing anything. Dale, would you like to make some comments before we wrap this up?
Other than to repeat the thanks to Lisa and Simon, and as Simon just said, Melanie's unwell, and I know would have liked to have been here because she has been the constant in this. But it's should be no surprise to members that a project of this complexity, and particularly when you're looking to integrate customer-facing business systems with the world of IT, that over the last couple of years, I'm not aware of too many projects of such that have not suffered from the effects of resourcing issues. And members will be aware that across the council and across the People Directorate in particular, we're doing a thorough examination of all our IT interfaces and business systems. But I think members, from the evidence that you've seen here, can rest assured that the importance of the right customer-facing approach to the Blue Badge is uppermost in the officers working with those people. I think it is important that we understand that the review that the scrutiny panel did wasn't about ensuring more people get blue badges. It was about ensuring that those that properly qualify have a reasonable and acceptable experience of obtaining their blue badge, and that we, the council, and those involved don't add to any frustrations to do with it. So the commitment of the officers in the department to that remains strong. And in terms of, as I'm sure councillors will on the meeting will agree, it's a measure of a particular subject is the amount of input we as councillors get about blue badges. And from my point of view, the number of queries that I have had either directly or processed to me from members has, during the period of this project, been minimal. And I think that's because of the amount of work that's already gone in before the IT has been looked at. And I'm particularly talking about changes in attitude and language, and about the human interface first. So I hope, Chairman, that members of the panel can feel rightly proud of the rigour of their initial review and the recommendations, and that can see that there is, from my assessment of it, no element of those recommendations that have not been addressed or are not being addressed. Thank you, Chairman.
Thank you for that, Councillor Birch. Very helpful. In summing up, I would like to take the minutes of this meeting to go to the Wellbeing and Scrutiny Commission. So I'd like councillors to agree to the recommendations that we originally put 1 to 7, that was the Word document that we've just gone for, so that can be put on. Additionally, I'd like to make sure that we note the offer of councillors who have blue badges, members of the public, for that continuation of making sure that we have looked at users. I mean, when I initially looked at, we were nearly 2 years on from the initial recommendation. I have to say, from recommendations from that panel, which I did not lead, I was a bit worried. But having heard about the diligence that's been put into making sure that the system works properly, to echo something that Dale, Councillor Birch was saying, it's making sure that the system is transparent and fair. It's not about just saying, yes, let's issue more badges. It's about making sure people are aware how it goes, how those interactions are. And I think Lisa Jewell's done an excellent job in the short time that she's been involved in pushing these forward. So thank you to all the officers involved on that. But can I get councillors' agreement to those recommendations to go for under as agreed by Executive 2021? You can see, should be able to see that on your screen at the moment. I don't think anybody else has asked to come in on that. So can I get agreement? Can you raise your hands or?
Well, yes. Well,
agreed, Mike.
Yep. Right. Hold on a moment.
Agreed.
Yes. Hands up.
Agreed.
Hands.
Agreed.
Thank you very much for all the work that's been done. I'm actually very impressed. There's still a few things to be sorted out, but to actually see these with the vigour that is being pursued, I'm very impressed. Thank you very much for attending, and look forward to seeing half of you again at the PRG, which is the next meeting we've got to go. Thank you, Louise.
Yep.
Thank you.
Yep. Yep. Thank you very much. Good night, everyone.
Thanks. Good night. See you soon.
See Mike in
So
25 minutes.
End the meeting.
Right.
We're live.
Much.
Good night. Thank you.
Louise, can I talk to you before you go off?